Good morning, Virginia. This is Virginia This Morning.
This Partners in Healthcare segment is sponsored by Hopewell Healthcare Center, a nursing and rehabilitation center.
Next Step Home is a specialized program making a smooth transition from hospital to home successful. Lindsay Reynolds with Hopewell Healthcare Center and Ermelie Grammer, who spent time at the center, join us this morning. Thanks for coming in, ladies.
Thank you for having us.
Lindsay, we first talked earlier this year in the spring, and you introduced us to Hopewell Healthcare Center. Tell us a little bit about the facility.
Well, we're a 130-bed facility in Hopewell, Virginia, near Fort Lee, and we specialize in short-term rehabilitation as well as long-term living.
And you rolled out a program, your team there rolled out this Next Step Home program in January, and how is that, tell us about the program.
It's going very well so far. It's basically a transitional program from the hospital to home, and our goal is to get patients home as successfully and safely as possible.
Now, Ms. Grammer, we'll talk with you in a second because you've gone through the program and it really was beneficial.
Yes.
But Lindsay, you have some scientific data we're going to take a look at, but this really does make a big impact for folks coming through the program.
Yes, it does. It's just a small portion of what we've seen, the success rates. I just took one patient and put together two different graphs, one on physical therapy and one on occupational therapy, kind of to see that where they came in at and where they left at.
Okay, fantastic. One of these graphs is up, and it looks a little bit like this is the outcome summary for PT.
Okay, yes, and this is a patient who came in with a fractured hip, and they were in our facility for 42 days. And as you can see, when they first came in, the green, which is the admission, they started out being between 0 and 1, which means they're either dependent or used maximum assist in these 5 different categories. Now, when they left, they were measured at 5s, the last 3 you see, and that means they were totally independent.
And the next one that we have to take a look at is this is the occupational therapy or the OT?
Yes.
Okay.
And again, this is measuring lower and upper body dressing and as well as bathing. And as you see, they came in and they were between a 1 and a 2, which is between max and moderate assist. So they were getting a lot of assistance from our therapy department. When they left, they were at 5s completely across the board, which means they were totally independent. So in 42 days, they went from needing help all the time to totally being on their own.
Now, you can see that very easily between the green and the yellow, but Ms. Grammer, you've gone through it and you felt that difference in coming through. Tell us a little bit about your experience.
Well, I was admitted to the health care in April, on 6th of April, and I was there until May 13th. And during that time, of course, when I first went in, I had surgery for a hip, and right away they were just, everyone so kind and helpful, always wanting to help you, all the personnel, and from the housekeeping to, and Mrs. The clinical liaison, June, she came through all the rooms every day. In fact, every day she came to see if I was doing okay, if I needed something or some help. And the dietitian would come up very regularly to my room to see if there was something special I would like to have to eat or if everything was okay.
Now, you had fractured your hip and were in the hospital, but then had to make the decision. I mean, everybody has to go through rehabilitation.
Right.
But you had chosen Hopewell Healthcare Center.
Right, because I knew that they would give proper care and were very concerned about all their patients. And that's why I chose to go there. And also the aspect of my family visiting, and that really was really great. Everybody was so nice to them, and we, in fact, my daughters and my grandchildren would come every day, and everybody was so nice, and it just worked out wonderful.
And that kind of positive energy, and knowing that it was easy for your family to get there made it probably a lot more comfortable.
Yes.
Fantastic.
Yes.
Well, great. Thank you for sharing today.
And the best part was that being able to go outside, my grandchildren, my grandson especially, would come and say, "Come on, Grandma, on Anna, we'll go outside, and they take me out. Every day I got to get out to go outside in the wheelchair, and there's a nice outside area to sit and watch down by the lake, and watch the ducks and the geese, and it's just a very, very good atmosphere for healing.
Super high quality, and especially with the grandchildren there, just
Right.
a lot of good energy.
Yes.
All right.
Yeah.
Well, thank you so much. We'll let everybody know how to get
you.
in touch with you guys. Appreciate it.
Thank you.
Learn more about Hopewell Healthcare Center, one of your partners in healthcare, and their Next Step Home program. Visit 905 Cousins Avenue in Hopewell or online carevirginia.com/Hopewell or call 458-6325. And be sure to watch next Tuesday morning for the Partners in Healthcare segment featuring the Partners in Healthcare team. They're celebrating their first anniversary of Partners in Healthcare as a group.